Chief Medical Officer Dr. Shamdeo Persaud told Headline News on Wednesday that persons traveling to Guyana from at-risk area in South Africa, including Angola, Congo, Nigeria, Niger, Mali, and a few others, will not be allowed entry without proof of vaccination at least 10 days prior to their arrival here.
Yellow fever is a deadly disease. We have all the conditions that can allow for easy spread in Guyana, including the mosquito and the salvatic environment, the forest and everything. So we won't like that to be introduced here.
Persaud said even if you are coming from Africa as a non-national, once you travel there, you will need proof of vaccination.
These precautions are absolutely necessary. We know what has happened with chikungunya and Zika and how rapidly it can spread. Yellow fever also has a high mortality rate. About a third of persons who are infected die. So it's just as dangerous as Ebola, for example.
Guyanese who are returning home from those areas and are not vaccinated will not be denied entry, but will be quarantined and observed. Persons traveling from the United States of America and Canada who have not traveled to any of the at-risk countries recently do require a yellow fever vaccine.
Once we can observe them for 6 days and ensure that they didn't develop any of the signs and symptoms of yellow fever, then that person will be free to, conduct whatever business.
I guess it's the ministry prepared to deal with the amount of persons that are going.
Going?
Yeah.
We have been modifying our vaccine procedures at the ministry. We've established some procedures that would allow for providing the yellow fever certificate. So first priority is people who have had vaccines. If they bring those cards, we can issue a certificate. We can also issue certificates in Region 2, in New Amsterdam, and at Lethem. Mercy Hospital is also assisting a private site in issuing those certificates.
There are some countries in South Africa and the Caribbean that have been designated to be at risk, but Dr. Persaud said the authorities here have been wavering the requirement for these destinations closer to Guyana. George, Suriname and Trinidad are also on the list of countries where there is a risk of yellow fever, and while it is advisable to have the vaccine, persons coming to Guyana from these countries would not be denied entry. Yellow fever is an acute hemorrhagic viral disease transmitted by infected mosquitoes. The symptoms include fever, headache, jaundice, muscle pain, nausea, vomiting, and fatigue. George, back to you.